If someone has had blood pressure for 20 years, they will not have a stroke. They may or may not have a stroke, but there is something which has precipitated as a stroke. So we need to find that emotional cause. What happened? What triggered? Where is the unresolved grief, or the relationship has an issue? There's some strain. There could be something that has happened at home, workplace, friends. It could be any relationship that has been affected. So that's very important to understand. When people retire, okay, when they've made their life, their job, their entire life, not having work bothers them a lot. That makes them very anxious. Okay, what next? What if I'm not productive enough? What if I'm good for nothing? That those emotions can definitely trigger something much deeper in you. And I would also I would further ask questions. Okay, were you retiring on a happy note or not?
So I have Dr. Mallika over here with me, and she's an MD physician, MD in physician in homeopathy, and we are today going to talk about stroke. So Mallika, how many cases of stroke have you seen, and like what is stroke exactly? Can you tell us about it?
Yeah, so stroke is when there is reduced blood flow, either because of any damage to the arteries or because of a tissue damage, right? There are two types of stroke. It could be a hemorrhagic stroke or an ischemic stroke. Ischemia is when there is poor blood supply or less blood supply, and hemorrhagic is when there is any kind of thrombus, embolism, or because of an artery which is burst. So that's an hemorrhagic stroke. Both of them, there are more high. There are very high chances for you to see a ischemic stroke compared to a hemorrhagic stroke. And hemorrhagic stroke is generally seen in someone who is above 40. Like 20-year olds, very less, they're less often they'll have a hemorrhagic stroke. It's more common in someone who's above 40, or on blood thinners or something of that sort. Ischemic stroke could be anyone could have it at any point. It could be because of an injury, it's because of any of the medicines that they've been taking, which it's not suiting them, or it could be just because of their lifestyle habits. That can cause an ischemia. The way you would have it in your heart, the same way you would have it in your brain.
So it's basically like a brain attack,
Yeah.
as compared to a heart attack. So if the blood flow to your heart is reduced, then that is a heart attack. If the blood flow to your brain is reduced, it's a brain attack, which we call it as a brain stroke. So what are the symptoms that come usually when a stroke is there?
So, first of all, there are four primary things. You have to remember FAST. FAST. F stands for face drooping. Okay, one-sided, your face is lopsided, and you should always check for a smile that time. If the smile is very lopsided, that's your first symptom. A is the arm strength. There is numbness, tingling, or complete loss of strength in your arm. You cannot lift your arm. The third is S, which is speech. Speech difficulty, aphasia, cannot say simple words. That's speech. And T is time. So time is very necessary in stroke. Within minutes, even 1 minute of less blood flow can have tissue damage in your brain. So every minute, every second counts. Immediately, if you think any of these three signs is seen, you should immediately call an ambulance, and you have to rush to a doctor or a center.
Right. So, it is possible that all the three signs and symptoms may not be possible. Sometimes patients just lose their consciousness.
Completely,
They
yeah.
just fall somewhere, or they just black out for a few seconds. But any of these signs and symptoms, if present, they have to immediately rush to an emergency doctor.
Yeah, so these are the primary symptoms. The other symptoms could be blurry vision, unconsciousness, you suddenly fall, there is numbness or tingling, or it is just disorientation, right? You are not understanding what is happening. Disorientation can present in different ways, and there are other diagnoses also. But yeah, this is one of the signs that they might be getting a stroke.
So that this public awareness, I think a few of us do have an awareness that what stroke is, but there are still a few places where this awareness is lacking about what a
Absolutely.
stroke is. And many a times what happens is the previous day someone has had those symptoms, but it just is there for a few seconds, so they don't do anything about it. And it's completely normal. They go on with their routine after that. But the next day, it again comes back with a very bad sign, and that is when they actually go to the doctor and they find out that they've actually had two consecutive strokes the previous day and on that day itself. So these are like very, no, very like small signs and symptoms, but something like this needs to be
Exactly.
taken
So the way someone tells
care.
you, right, Ray, you already had a heart attack and you didn't even realize. Very similar. But at least sometimes for heart attack, you may have symptoms or that might last for more than, few seconds. But for stroke, sometimes the episode does not last for more than couple of minutes. But when there is a bigger stroke, the signs, symptoms, as well as the precursor is pretty long.
So, what are the risk factors in stroke which are there? So, like, what kind of individuals are more likely to get a stroke when there is?
So, someone with very high blood pressure, someone with already a prehistory of any cardiac event, uh, known cases of any smoking, tobacco, or the people with any drug allergies, they are always at a higher chances of stroke. So this is something I would say physical causes, right? When I am talking as a homeopath, I always believe there are always emotional stresses. There's something psychodynamically which affects you. Someone has had blood pressure for about say 20 years. Not everyone has a stroke, right? Someone has been smoking for 10 years. It's not like immediately they will have a stroke. There is always an emotional factor which then precipitates as stroke. So something like your emotions are very trapped. Okay, your suppressed grief, your somewhere you think that you cannot get out of a situation, and very high risk of stress, not something very small, okay, something which is short lived, something has been there or precipitating for quite some months or years, that may also precipitate as stroke. So if I talk about physical causes, there is always an emotional turmoil also, psychodynamically, there's your body is giving you signs, but you may not know it. That's another factor. Physical causes are always there, right? You cannot neglect the physiology as well as the pathological causes. But with that, psychodynamically, emotional causes play a very vital role. It could be grief, okay, unresolved grief of many years, or resentment, feeling of being trapped. Okay. So with homeopathy, it's not just treat the physical symptoms or the physical results and the diseases. There is always something which is very deeper that has resulted into this. It's not necessary everyone with blood pressure will have a stroke. If someone has had blood pressure for 20 years, they will not have a stroke. They may or may not have a stroke. But there is something which has precipitated as a stroke. So we need to find that emotional cause. What happened? What triggered? Where is the unresolved grief, or the relationship has an issue? There's some strain. There could be something that has happened at home, workplace, friends. It could be any relationship that has been affected. So that's very important to understand. We give physical causes and emotional causes same weight. We do not just say it's only because of an emotional cause or just because of a physical cause. So yeah.
So basically, after a stroke, what role, how do you come into the picture, and what role does homeopathy play uh, for the recovery of a stroke?
So first, it's invariably the patient is in the hospital, right? Like the first few hours, few days. Once the patient is back, we can start with speech. Okay. a lot of times there are different, whenever there's stroke, different parts of your brain are affected, either your frontal lobe, either your vision, your speech, or eating. Everything gets affected, your arm strength, weakness. So we start working on everything. We start working on your speech. So what we have to work on is improve the tissue damage that has already happened. Those damages are almost irreversible, but how to improve that and how to start reversing that, that is where we work. Second is strength. The neurological disturbance that you have in your arm because of the stroke, we work on that. So with rehabilitation, how you give the strength to the body, right? So everyone loosely uses something called immunity. Immunity generally is only used for infections. Yeah. Right? For us, immunity is equal to vital force. So we make sure your vital force is given that stimuli so that you are able to do it. Right? So when you have any disease, that's when your vital force is deranged. That's when your disease state comes up. So we have to make sure your vital force is in your bodily rhythm. It makes sure that what you were earlier, it puts you back on the same track. So when it comes to speech, where it comes to visual disturbances, or it comes to a lot of people start having incontinence also. Right? So that's where how the connection between your brain and your sphincter is connected. So you work on that pathway. You work on the left and the right side of the brain. It's not that we do not work on the physical symptoms that have happened, right? A lot of patients start cursing. Why did this happen to me? How did this happen to me? What did I do wrong? So that emotional state, to make sure that they don't lose hope, they don't become, you know, the kind of anguish that you have because of their disease state, that is taken care of. So holistically, we will not just work on their physical symptoms, we'll be working on their emotional and subconscious symptoms, because there was some conflict is where that's why this disease has come up. So until and unless the root cause or that conflict is not resolved, we won't see that change. There will be some changes, okay? With time, obviously the body starts getting better, the body knows how to fight it, right? But it's never to to a limit that the patient feels very energetic and better. So to make sure that the patient is as good as what he or she was before the stroke, we give homeopathic medicines accordingly.
How does homeopathy help after a stroke? What signs and symptoms do you address with homeopathy, and what recovery happens with them?
So, with homeopathic medicines help one with whatever weakness, paralysis, numbness that has set in. Secondly, the spasticity or the tissue damage that has happened. It works on regeneration of those neurons. It helps for the brain to start even after you're giving medicines, right? You're giving anticoagulants and all, for your brain to start going back to the original activities. That stimuli is what homeopathic medicines give. And third, the emotional state, the anxiety sets in, depression sets in, there's emotional imbalance that sets in after the stroke. So the medicines work on elevating your mood. They will work on maintaining improving your confidence, because there is major loss of confidence that happens after the stroke. You're not able to do something very simple that you were able to do. That despair and anguish that is there, we work on the emotional aspect and the subconscious aspect, and that improves overall the quality of life, your mood, your physical willingness to do any activities. The even going back to work, you get better, but going back to work or going back to activities that you probably could do but now you think you may not be able to do, homeopathic medicines help with that.
So, as you said about the emotional part of it, before the person actually has a stroke, there are some factors which come into play. So I can remember one patient of mine. She was always a very headstrong person, and she always wanted things to be done on time. The schedule should be perfectly done. So if it is 9 o'clock, it is 9 o'clock. Even 5 minutes delay is not tolerated by her. There were a lot of such factors, but she was also excellent at her work. She was very good at what she was doing. And when she had the stroke, unfortunately, she was out of Mumbai, and she was not at a place where there was medical help easily available to her. So when she had a stroke, she blacked out completely. She was unconscious, and nobody around her even knew what to do about it. So they rushed her to the hospital, but the hospital was not well equipped to manage such a case. She had a hemorrhagic stroke, and because of that, there was almost a 10 hours delay in which, when she was brought to Mumbai to be treated, she had not got any treatment done, and there was significant damage done by them. But after almost 6 to 7 months after the stroke, so we've been with her since the beginning. After the stroke, she tells me that especially when I had the stroke just a week back, a week before that, was the time when I'd actually retired from my work and I was going to start doing other things after that. And that is when I was having a lot of emotional ups and downs, because I was not sure about what I'm going to do now after retiring, and what I'm going to do with life. Like my work has been my entire life. So what I'm going to do and everything. So that is when I actually had the stroke. So could that be related to
Definitely.
this whole
So
episode?
one is, when people retire, okay, when they've made their life, their job, their entire life, not having work bothers them a lot. That makes them very anxious. Okay, what next? What if I'm not productive enough? What if I'm good for nothing? That those emotions can definitely trigger something much deeper in you. And I would also like, I would further ask questions. Okay, were you retiring on a happy note or not? Right? See, retirement comes, it's today you turn 58 or 60, you have to retire next day. Yeah. Like, they do not give you that option. Oh, you can take 6 months, you can find something else for yourself, and then move out. That change is so quick for your body and your mind to adapt. Sometimes that gets very difficult. So that's always a cause. And there could be just, what should I do so that I'm not in this state? That can also cause a lot of emotional setbacks and turmoil. to, to think about what I've already been through, the things with colleagues, with their bosses. So if those things start triggering at some point, yes.
Also, the fact that when you're retiring is when your children are already grown up. They already either are settled somewhere, or they are married, or they're already like away from home, or even if they're at home, now you don't have anything to look after for them. Your life has been that you're looking after your children, your family, and you're working as well. So after that, also that empty nest syndrome, which is there, that is also very important change in the
Yes.
phase of your life. And definitely, so what do you recommend someone who is about to undergo that significant shift in their life, not just retirement but any kind of shift? Like maybe it could be something like being single and then getting married, or going into the phase of motherhood, or having lost someone in their family or something. So a significant shift. So what do you suggest that people can do for that?
So I think all these scenarios are very big shifts, and it is very, as an individual, what they would do, right? I won't be able to give a very general guideline, but being prepared is more important. See, when you lose someone, it could be sudden, or that someone's been suffering for very long, and that's why they might leave you at some point. Being prepared, nothing will never ever prepare you for some kind of grief, but still trying to tell yourself, this is bound to happen, this is probably for the better. That can change the mood, that can change how you will react to the situation when it's actually in front of you. When it comes to motherhood, now there is sanskar happening. Now, people say, okay, it's important to detox and, make sure you are doing journaling, you're doing this. I think it's very important to understand emotionally, if you are not going to be prepared for it, it's not going to be an easy journey for you, right? When people say, oh, you should be journaling, or you should, put aside certain time for yourself, for you to think what you want, how you want it, that will set you on a road. Okay, oh, this is what you want, this is how you want it. So that preparedness again changes when you are moving from one job to another, or you are retiring. I'm not saying from tomorrow you should have, next thing to do. But yeah, no, there's no necessary for a plan. But even that preparedness, it's okay at that content, that yes, whatever I've done, whatever I've achieved so far has been great. Now I want to look forward to the next thing. So that preparedness makes a lot of difference. That makes the shift in your energy.
So, what kind of patients you worked on with homeopathy for stroke, and how have you helped them with homeopathy? If you could share a few stories yourself.
Yeah. So, first, I would like to talk about this one 50-year-old lady, right? She was she was my patient on and off for other things, like, ureteric calculi, kidney stones, and everything. And I had not seen her for, a couple of months in between, and then I got a call saying she had a stroke, and she was in the hospital for 3-4 days. She's so far now, she's on aspirin, she's on blood thinning medications and everything, but the speech is affected majorly. One, she can understand what you're saying, but she cannot reply, she cannot respond. She is unable to count, and she cannot formulate a sentence also. She just stops on a b, or she has to, point out. This is what I'm talking, 1 week after the stroke. So when I spoke to her, she was she could not write because the left side was affected. Her main, she was left-handed. So she's like, "Hey, I cannot even write to tell you or explain you what happened." So that's what do you do then? You don't have any causes only. Something would have happened. That's why the stroke was precipitated, but you don't have any symptoms. So that's when you treated only pathologically. Okay, there was a stroke. You know what area was affected. You know right now what organ is affected, right? So I started with something like arnica to start with, right? Arnica, people will, "Arey, tum gir gaye, to take arnica," or something happened. People give arnica so loosely, but something like stroke, because there was a blood clot. Okay, arnica is given whenever the blood is clotted somewhere, whether it could be your arms, legs, anywhere. So this happened in the brain. So that's why I gave arnica to start with. That's when at least she used to have a lot of headaches because of the medicines, right? So the headaches started reducing, and she could then at least start saying some words. Okay, then I started asking her more questions about what happened, how it happened, and there was a conflict between her and her mother. Okay, regarding something that had happened in the house, and which did not settle very well. Okay. And she's like, hey, I don't know. I want to get out of the house. I'm like, this is it. I can't take it anymore. Okay. And that's when, after a couple of days, she had a stroke. So there was a conflict. There was that trapped feeling. And that's when then eventually it precipitated as a stroke. She's taking speech therapy. She's been taking OT. With that, with homeopathy, what we are able to do is that her speech starts getting better. See, with therapy, there's always someone makes you do, right? But there is something, if there is no brain stimulus, how will it happen? So we make sure your exercises are easier, your ability to do it is easier. The loss of confidence that you have after this, that gets better. We are still 1 year into therapy as well as the medicine. She can talk, but that won't be more than 4 or 5 minutes. Okay. Right? Or she can talk only in one language so far, but she can completely talk in one language. She's not been able to talk in two or three language, but it's okay. So with 1 year of therapy with OT, PT, and medicine, we have been reached so far. And in between, it's not like we have not treated her for other things. There are musculoskeletal pains. There are exactly. So you don't just treat for stroke, you will treat for other things also with constitutional medicine. So Anika was only the first drug that I had given. Eventually, she went on constitutional medicine. With time and with mental symptoms coming up more, then you increase the frequency. You start with 200, 1M, 10M. That's a different frequency. It's like 30 mg, 40 mg, 100 mg, the way you would give. It's the similar for homeopathic potencies. The more your emotional disturbances and the more emotional symptoms that start coming up, you start increasing the frequencies. This was one case. The other case was 30-year-old female, and she initially had cough and cold, and she's known case for epileptic like she's already been on epileptic medicines for a very long time. Yeah, epilepsy, akdi, and so this was a very close friend of mine, and she called me at 8 in the morning. Her mother called me at 8 in the morning saying, "Okay, there's something happening to her. You need to come right away." And I was like, I don't know, but I mean, rather, I think you should call the ambulance. Like, we'll do that. You just come. I was like, okay. And we don't live that far. So I went there and I asked her what happened. She's like, I can't move. Okay. I can't move. I was like, okay, what happened? Like something happened. Did you vomit? What is happening? It's like, I woke up. I was taking this medicine, and after which my face was drooping, and now I can't move. I said, we need to go to the doctor. Like, we need to, get you admitted. Till then, another family physician came. He saw her, but by the time we had reached, the speech was, I would say, slow. It was not impacted too much, and the face was okay. It didn't seem lopsided anymore. So we think it was probably just one of the small stroke. Touch and go. Yeah, the touch and go. The family physician came, he immediately gave injection. She felt much better. Later, like, but what went wrong was the first question. We went to see a neurologist. Okay, is this because of the epilepsy? There was some epileptic episode that they missed, or she's not taking some medicine properly, or there has been something different. So we saw the neurologist, we got the CT MRI done. So there was a CVA. There was a stroke in the left parietal region, but it was so small. So he said it may be because of the medicine that you took. So she was allergic to something called Domstal, and she had not taken it previously anytime. So even the neurologist was not sure it was because of the Domstal that it happened or it was actually a stroke. But after on CT, yes, there was a stroke and there was a blood clot which was found. In this case, I could give her medicine in the first 1 hour. So I would not say it was just the homeopathy that helped or whatever the family a general physician gave. The something that both of us did, it worked very well for her so that she did not land up in the hospital. This happened only because she was a very close friend of mine. She was my patient and I was accessible. Like there's multiple factors. Like she believed in me so much that I was the first person to call. Right, I was accessible, she was somewhere that I could easily go to, and I had the medicine that I could give her. There are so many factors to this case, but not every time you are going to have such a patient, not every time you are going to have those medicines. These times it's not going hold your ground, oh no, I will give only homeopathy. No, that you need to save the patient.
Yeah.
That is more important, that patient has to be seen by a neurologist or any hospital nearby.
Yes.
Right, first once the patient is stable, then you start with your treatment. That's great. Then whatever information that you get from parents or anyone who's around, it works very well. And with whatever medicines and injections that has been going on, you can start with your medicines also. That never hurts. Obviously you have to take permissions and all, you, because he or she is going to be in someone under someone else's care. The primary care is someone, always someone else. You will be the second person here. So once you take permission, once the patient, the family members say yes, then you can start with the medicine. But that's one case that stayed with me majorly, I would say. And for now, I still have three other cases. That's they they've come after 6 months of the stroke that has happened. They're already been taking therapy, or someone's come after 5 or 6 years also. So when someone comes after 5 or 6 years, those the tissue damage has not been reversed. One. Second, they've done everything and anything,
Yes,
right?
yes.
For their body to respond, it takes a lot of time. I would say stroke was something that happened 6 years ago to them. After that, there would be so many different things that has happened to them. So for me to start treating the stroke symptoms is going to be after whatever I have treated
In the
earlier.
6 years, whatever it has gone.
Exactly, whatever incidents that have happened. If the patient has developed diabetes, they've developed tingling numbness, neuropathy. So those things will be the first things that I have to treat. That's when I will reach the core for what and how the stroke happened. So yeah.
Okay. So it's actually like a very systematic approach to the entire thing. And so, even with physiotherapy, we say that there are multiple things. Number one, that when a person gets a stroke, starting physiotherapy immediately after the vital things have been taken care of, the blood pressure is under control, the cardiac issue, if there's any cardiac event that has happened, that is under control. The patient is conscious and can start understanding what, even with with a unconscious or a comatose patient, we can still start with physiotherapy. No harm in that. But as soon as everything is taken care of, immediately starting physiotherapy the next day itself is very important, because we want that once the tissue damage occurs and the blood again starts flowing in that area, whatever brain regeneration is going to occur, new pathways are going to form, new neurons are going to form, that all occurs with the right amount of movement, the right kind of movement that we give to a patient. So it makes a lot of difference that when physiotherapy is given properly, neurophysiotherapy is given from day one itself. After 1 year, how the patient is going to show up, and versus if physiotherapy is not given properly for at least 10 to 15 days, and after that the patient is starting to getting treated by a neurophysiotherapist, that matters a lot, because after 1 year the patient is going to be in a very different
Yes,
scenario.
absolutely. So you can actually, there are studies, you can see them in your patient, someone who's come in early and how well that patient has improved versus someone who's come much later on, and how what difficulties you face, the movements, the stiffness that has set in, the uh, I think the willingness also,
Yeah.
that changes. That they've already for 15 days or for a month, they've been struggling so much that they eventually give up hope also. And some cases are, still not that bad. Some patients are still okay, that they might be willing to take therapy. There are patients who are completely on bed after the stroke. That's when the family is not ready. They are like, it's okay now, मतलब क्या ही तुम कर लोगे ऐसा, कि इतना क्या हो जाएगा कि तुमको इतनी दवाई लेके ऑलरेडी when they come back from the hospital, they are given a set of medicine. Yeah. Okay, and if the patient is completely bedridden, So for them to anyway manage the patient who is a bedridden patient, keeping a helper or at least two people from the family are completely homebound. So are already, so they feel so burdened with other things. They are not willing to try something else. Whether it is therapy, whether it is homeopathy, whether it is acupressure, acupuncture, anything, they are like, oh, we are done. I think हम इससे ज़्यादा कुछ नहीं कर सकते, and we are only accepting कि this is it. So and we right now see cases of stroke, most of us in the clinic, which are middle class, upper middle class. But low middle class people or people who are very poor, they can't afford therapy. For families to take them to the hospital, even if there's a state government run hospital, for to take them for therapy is a challenge. Okay, you travel by, you don't have your vehicle, so तुम cab में लेके जाओ. The economical cost that comes up after a stroke patient, that's more difficult.
That's difficult, for sure. I have worked in a government hospital, and I also like started my own practice. So I'll tell you exactly what happens because I have worked with acute also. So just today only the patient has had a stroke,
Yeah.
and I'm seeing them the next day. So I've worked with those cases also, and I've worked also with patients who have come to me after a few years. So what happens when you get a stroke? When you get a stroke, after that, immediately once the vitals are taken care of, you are discharged and you're either told that you have to stay in a ward for a few days under supervision, or you are even sometimes sent from the emergency room itself that abhi, medically you are taken care of. Now you have to go home and recover from it. So once that happens, already the hospital costs and everything have been in lakhs. Or if you are in a government hospital, then also a few days have gone in which your family is also taking care of you. So for them, the working days are gone.
Yeah.
So like if you have one or two brothers, or if you have kids who are taking care of you, so they are not going to work. So they are already taking a few leaves. Once you are back home, your army around you, the army as in your family members around you, are only going to be around for a few days because they then have their own responsibilities to take care of. So that is when you really tap into the potential of your own recovery also, and your family support also being there. When you go max with your therapy, for the initial 1 or 2 months, I always advise my patients that you have to do your therapy at least for 3 to 4 hours in a day. With us, 1 hour, but other than that, also keep repeating it every 2 hours with your family members also, as per how much ever your capacity is, because obviously you had a stroke, so your body is also weak, you are feeling very tired and all of that. But you have to keep repeating those exercises with your family members as well. So doing that is very important. Second thing, if you are in the lower middle class part of it, you can also consider, going to a center near you, which is a little low cost. So in India, we still have multiple options for people to go. So they can choose to go to an OPD, which charges a little lesser. So in fact, I had one patient who's had a stroke 3 years ago, and he is actually of that lower middle class population. He was a taxi driver, and after the stroke, he obviously, because one side is paralyzed, he could not drive the car anymore, and he doesn't have any successors, so he doesn't have any children who can support him for his treatment. So he must have undergone physiotherapy for around 6 months, and after that he had to stop because of the financial exhaustion. Recently he came across me through a homeopathy doctor only, and she said that why don't you just try again? Something can come out of it. So he said that okay, I'll call her. So I went, and he's like, hey doctor, I can only afford one session with you. So you let me know what exercises I should do. I will do it on my own, and I will let you know how I'm feeling. So I reviewed his case and I saw what exercises, and there were a lot of gaps also in his rehabilitation which was still not addressed. So I gave him a few exercises. After 15 days he's calling me and telling कि डॉक्टर मेरा जो हाथ नहीं चल रहा था आपने उसको वापस जगा दिया. So I was very happy and I was like, okay, I mean, it's because of you that you have actually followed those exercises that it has given you
Right.
results. It's not like I have worked any magic or anything, but it's just that your conviction that okay, something can happen, so let's give it a try, that has really worked for you. So slowly we are progressing with him, and in fact he called me again for another session. Sure. To just review again and again progress on a few
Wow.
exercises that are there. So yeah, I was talking about that. So and make sure that you are doing your therapy very aggressively in the first few months, because that is when the potential for recovery is that much more, and you also have a good family support around you, because once your family gets busy and doing their own, it's life, they are going to get busy. So you have to make sure that you are very aggressive when you in the initial few months after the stroke. And after that, so what physiotherapy brings about is economically, when you undergo physiotherapy, what I have seen is number one, the caretaker dependency reduces. So earlier, if you had a caretaker for 24 hours, now the caretaker is only required for a few hours in a day, or only at night when you need to go to the washroom or something, the caretaker is around you. Number two, you were on a catheter or you were on diapers because the urine control was not there. With physiotherapy, because the core strength develops, the muscles become stronger. You start developing you start regaining your urine control, your bowel control. So automatically, the number of diapers also that you use in a day reduce. Goes down, yeah. And you know how much the diaper cost is. Absolutely. And with catheter, there's always a chance of infections. The every time you get the catheter changed, you need a nurse, the costs keep on increasing. So until unless we do not make them self dependent, this is going to happen. So with therapy, that if that cost comes down, I don't know how many people actually understand the value of it. Okay, or try to weigh it. With therapy we could get rid of this, so that's a good thing. Yes, that's a good investment. Exactly, because people just think very in a linear manner. Yes. Okay, every session costs so much, or every medicine is costing so much. We are already taking so many medicines. Your medicines also reduce, in fact, with therapy. That's the whole point. 15 medicines in a day, it comes down to just 4 or 5 medicines in a day, which are absolutely necessary to control your blood pressure or to avoid seizures. So those are the medicines which you are anyway going to take lifelong because correct, it's important. But the other medicines which were there earlier, they all come down because the physiotherapy works that way with the it enables the patient to do, yes, things on their yes, by yes, themselves. So I've actually had patients who used to use a hospital bed because they were not able to sit upright because the muscle control was not there. With physiotherapy, we were able to achieve their upright posture. They were starting to get up by themselves with very less support, either using a walker or very less support with a stick or something. They started going to the washroom. They started using the different areas of the house. They started moving out. There are a few patients who even went back to their work itself. So they started earning again. So they must have had a setback of maybe a few months after the stroke, but they started earning again. So then the money also started coming back. So with physiotherapy, it's an investment. Okay, you're investing maybe say a few thousands of rupees in a month in physiotherapy per session, depending on where you stay, what the cost of physiotherapy is over there. So you are investing a few thousands of rupees in a month, but long term, it's like you will get back that money because that independence comes in after physiotherapy. Because what we are providing is quality of life. So it's not just, you are sitting in one corner. We are not letting you be a vegetative state. Yes. We are giving you that quality of life, and it's not, and you are entitled to have it. It's not like you are not supposed to have it just because you had a stroke. You should not have a better life. You should have a better life, and that's what we want to provide. So, with physiotherapy, if we can improve someone's quality of life to 50% from what they were,
then absolutely. It's a very big investment to your future health. Today, if you start eating healthy and you want to cut down carbs, you want to cut down junk, that's because you are investing in your health, which is going to maybe anyway start going down after 10 years. But that change in lifestyle habits is going to improve your life later on. If this is what we think as nutrition, we have to think that as physiotherapy also, that if you do not take care of yourself right now, imagine what will happen after 10 years, when you're not going to take exercises, when you're not going to be aware of what you can or what you cannot do. You are not, you are giving away that hope to help yourself.
Okay, so when the question comes about, how long should someone take therapy for, how long should someone take homeopathy and also physiotherapy? So we can discuss that as well.
So, when a lot of patients, first thing, the minute they start, they come, they're like, कितना महीना लेना पड़ेगा, कितने दिन लेना पड़ेगा? It depends on every individual case. Every patient, the way they are going to respond with the medicines is going to be very different. As I said, there are going to be different layers, right? It's not just stroke or the symptoms of stroke that we are going to deal with. We are going to do much deeper understanding. We are going to be treating their other symptoms also, whether there is history of migraines, there's blood pressure, diabetes, there's going to be gastric complaints, there's going to be series of things. Right? So I will not have a definite answer that how long they need to take it. Once they start getting better, and once I know that they've been for under my treatment for this particular thing for about 6 months or 7 months, they're completely better. For the next 2 months, we'll say you stop the medicine, see how you feel. If anything comes up, we can again start. Otherwise, you're good to go. But that happens patient to patient. When it comes to a stroke patient, 8 months of medicines is minimum, because the organ is so deep. For the organ to have its own vital force and getting back to the track takes so much of time. 8 months is minimum. We tell the patient that you need to see, for you to understand, oh, this is the changes from day 1 to day 30, what changes that you've observed, and from day 30 to day 60, what we can do will only be in understand when you have a larger picture. When you have someone with us for 6 months, 8 months, that's when you can track the progress better. Right? And it's not going to be just one medicine for 8 months. The medicines are going to change as per how the patient is feeling, what the patient is experiencing. And till the last medicine, till the patient is completely fine, we will not know that this is the last medicine. It all depends upon how well the patient has responded to it. So every patient is going to be different. The timeline is going to be very different for everyone. So therapy generally, how long would you suggest?
So I usually suggest that someone undergoes physiotherapy aggressively for the first 6 months after a stroke. If they can well afford financially, it's fine. Then it can also be up to 1 year. Again, as per the signs and symptoms. So sometimes some patients have very mild stroke. So for them, recovery after 6 months to 1 year is complete. But some individuals still need a lot of more years to get back from it. So it depends on the severity of the stroke that they've experienced. So at least 6 months is the minimum after a stroke that they should undergo. Other than that, more than that, after 6 months, they can undergo a little lesser in the intensity. So if they were doing 2 hours of supervised physiotherapy for 6 months, they can come down to 1 hour per day of supervised physiotherapy. After a year of the stroke, they can actually come down to 3 times a week or 4 times a week, depending on how their own compliance with physiotherapy is as well. So if they are doing exercises at home already, they can just come 3 times a week to the physiotherapist, get an update on their exercises, progress on things which are already better now. They can progress that way. But I would suggest that some people who had moderate to severe stroke, they should undergo physiotherapy at least thrice a week, lifelong after that. So lifelong, I would say that how much ever, till the time you want to stay independent in your day-to-day activities, you have to undergo physiotherapy because age is a factor that catches up very early. So someone who's had a stroke is usually in their middle age, like 50s or 60s. After that, they do recover, but the age is a factor which causes the brain to degenerate naturally as well. So just like your skin degenerates, your bones degenerate, even your brain starts undergoing age-related degeneration after a certain age. So undergoing physiotherapy lifelong till the time you want to be independent is very important in that, because once you leave physiotherapy is when the digression, the what you used to be able to do earlier will start coming down as well. Correct. So I've had a few patients who've come to me after 5 years of stroke. They had stopped physiotherapy for a few years in between. सो दे से दैट अरे पहले तो ये सब कर सकते थे, पहले तो गार्डन में जाते थे चलने के लिए, पहले सीढ़ियाँ उतर चढ़ इजीली करते थे, अभी वो सब बंद कर दिया है, अभी घर पे ही रहते हैं ज्यादा. So then I tell them that yes, you've not had another stroke, but you've had age which has caught on. Correct. You've not continued with exercises yourself after you had stopped physiotherapy. So I would say that continue physiotherapy lifelong, and you can then cut down to 2 times a week or once in a week. And other than that, carry on with exercises at home as well. So it's not just going to a physiotherapist is important. It's time that you have that lifestyle modification. Lifestyle. It's time that you start prioritizing your health, and it's your physical movement that is very important. It's not necessary, oh, every day I will go to a physiotherapist after 2 or 3 years of aggressive therapy. It's about what you are going to do. It's about you undertaking, oh, this I have to do any which ways, irrespective I'm going to someone, and this is what I'm supposed to do for my body, because I'm going to age, right? There are going to be certain things that will happen to me at a different age with different time. So until and unless that modification you do not take it up, you will start going back. So it's very simple. You just the way that you regularly go to the gym, or you regularly do some kind of activities, like you go to a Zumba class or you go to a fitness class. It's very similar to that you undergo physiotherapy as an exercise and a lifestyle modification for yourself. Yeah. That is the basic funda of the whole thing. So, what kind of resources would you recommend to our viewers for learning more about how homeopathy helps? Apart from what we are already shooting, right? There are books about introducing homeopathy for lay people, what homeopathy is. Rather, you can also reach out to any homeopath around you. Okay, there's someone who you know about it. It's like, but you don't know. Oh, even stroke can be treated with homeopathy. Reach out to them, ask them whatever concerns you have, questions you have. There are so many articles, there are research papers that people have published about homeopathy. So homeopathy and stroke, right? So there are we have about 4,000 remedies as of today. Okay. For stroke, I have more than 150 remedies that I can prescribe. So for me to understand the entire case, to go through the patient's history, I have to really study that patient in detail, as well as I should be very well read. Yes. Right? It's not that the system of medicine is not going to help you. It's maybe the person is not well equipped to help you. Right? The way for stroke, you will go to a neurophysiotherapist. You will not go to a physiotherapist who specializes in chest or respiratory medicine. Yes. Right? That's how, when you are choosing homeopathy for stroke, go to someone who is very well versed with it, or who's treated patients with stroke. Yes. It's about how the doctor is going to handle and perceive the patient, as well as the following treatment. Right? That makes a lot of difference, because people say हमने तो ट्राई किया था 3 महीने कुछ हुआ नहीं तो हमने छोड़ दिया. Change the doctor. Yeah.
ऐसा नहीं है तुम एक कार्डियोलॉजिस्ट के पास जाओगे, दवाई सूट नहीं किया तो तुम दूसरे डॉक्टर के पास नहीं जाओगे, यू विल. So instead of labeling the system of medicine that this is not helping, rather, change the doctor.
Yeah.
You know, the
See if someone else is more equipped or more suited to handle your case.
Exactly. And in today's world, you have so many Instagram, doctors. They are very well, they are anyway very good with their clinical knowledge and everything, but you can actually follow them on Instagram and, listen to what they are saying. There is someone called Melissa Kupsch. Okay. She's a Australian homeopath. She was originally a naturopath. Then she started studying homeopathy. And she has now started her own academy of teaching anyone and everyone homeopathy. Okay. Okay, it's a 2-year course that you can enroll with her. And the entire academy, and they teach you what homeopathy is, how homeopathy is. You can follow Melissa Coops, her Instagram handle is that homeopath. There is another called Real Homeopathy, Dr. Manjari Rao. She's based in Dubai. She talks a lot about homeopathy, but she talks a lot about natural remedies also. What and how you should take natural remedies, and depending upon where, what your body requires as of today. Okay, her tips are excellent. They're very well read physiologically, biologically, and what your grandmother will tell you 30 years ago. That's the kind of tips that she gives you. So that's really amazing. And you can actually find a lot of people to follow on YouTube. Please do not follow people who randomly tell you, oh, you can take this medicine for this complaint. No.
That's a red flag.
Absolutely red flag. Okay, you will not take medicine from any other person randomly. Then why will you take homeopathy or Ayurvedic medicine like that? You need to understand it is medicine. It is going to have effects. I'm not talking about side effects or it is going to harm you. It's going to have effects. Any drug pharmacologically, whether it is allopathy, Ayurvedic, or homeopathy, is going to cause effects. Whatever effects you don't want it, you call them as side effects. So obviously taking homeopathic medicine is going to cause some effects if you don't have correct knowledge of it, or the person talking to you randomly on YouTube does not know you. You are not supposed to take those medicines. Very simply, अरे एक डोज से क्या होता है, बहुत होता है, trust me. Okay, so please get in touch with any other homeopath around you that you know. You can get in touch with us. We'll help you, whether it is stroke, whether it is any other neurological complaints, right? And we can guide you better. If at some point we think we are not equipped to it, we can guide. We have resources that we can get connected you to someone else.
Right.
So yeah.
Okay, thank you so much for coming on the podcast, Brain on the Move, and helping us to enlighten about stroke and how homeopathy helps with a few things with regards to stroke and how you can aid the recovery of someone who's had a stroke. So, thank you so much for coming.
Thank you so much, Dr. Khushbu. It was wonderful. I'm really glad that you gave me the platform to talk. Thank you. Done.